Good morning, this is Rick Tantillo from the Alexander Spine Center in Seminole, Florida. Today I wanted to discuss something that seems to be like the age-old question. Do I use heat or do I use ice when I have an injury? And one of the most important things to keep in mind is, one, depending on the seriousness of the injury, whether you need some immediate care, for example, to go to see your chiropractor or to go to an urgent care center or the hospital. Once that determination is made that you don't need to go anywhere, then what you want to do is recognize that whenever you have an injury, that typically there's going to be inflammation associated with it. And when there is inflammation associated with an injury, we want to use ice on it. So ice is usually the first step in any type of acute injury. And usually what we want to do is keep that ice on the region, and we want to use that ice or cryotherapy for at least 48 hours. And basically the best way to do that would be to make sure that we have a towel between our skin and an ice pack, and put that ice pack on for about 15 minutes and then off for about an hour and a half. And then continue to do that cycle, and that will help reduce inflammation. When we have inflammation, we want to control the amount of inflammatory fluids that are rushing to the region, which can slow healing, and that's the purpose for the ice. Now, once the region is doing much better, then what we want to do is we want to start to introduce heat. So for the first 24 to 48 hours after using cryotherapy and after you're starting to feel better, then what we want to do is we want to substitute heat and cryo for about 24 to 48 hours. Remember, when we use heat to the region, you can use a hot pack, or you can use a moist hot pack. Most people will just use a heating pad, and you want to keep that on the region for about 10 to 15 minutes, and then again about an hour and a half off, and then do that cycle as often as you can. Once you're mostly stiff after the injury, 72 hours plus past the time that you hurt yourself, that's when you want to just use heat on the region and then start your stretching. So hopefully that helps. If you have any biofreeze, that's also something good to apply during any part of the inflammatory stage, which is the first 48 hours or so, and then on through to where you're just using heat to the region. So I hope that helps, and we'll see you next time. Thank you.